Welcome back, everybody, to Good Day Tulsa. It's now 9:44. Whether you wake up with it once in a while or it's a chronic problem, back pain, not easy to live with. It can be treated, and there's a lot of options available. Dr. Frank J. Tomecek of the Oklahoma Spine and Brain Institute joining us this morning to explain the pain and help us explore the treatment options. Appreciate you coming in today, sir.
Hi, Keith.
Thank you very much. We were talking about that. I think anytime you talk to people who have back pain, they just talk about how it's just unbelievably painful. What are some of the most common problems you see when folks come in?
Well, when I see them, they usually have a problem that has some of the warning signs that we worry about that I'll talk about in a second. But back pain, the most common cause is just muscular strain or soft tissue injury that can be caused by minor traumas or lifting. But then when it gets beyond that, it can be caused by several things. A fracture can cause pain in elderly people. A tumor can cause pain. But more commonly, a herniated disc is what I'll be seeing that causes back pain.
And you were showing me just a few moments ago, you had this is would it be a bulging disc?
Yeah, this is a disc ruptured back against a nerve. This is the nerve, this is the spine. And
which creates the pain.
When the disc pinches the nerve, then you start getting some of the warning signs of the nerve, which is pain that radiates down the leg, numbness in the leg, weakness in the leg, and then if the disc gets big enough that it pinches most of the nerves in the canal, it can cause incontinence of bowel or bladder, which is a very serious warning sign. And those are some of the signs that we have to suggest that someone like myself, a neurosurgeon, needs to see a patient and help take care of them.
Okay, now you've been doing this for 15 years, so you know what you're doing. There are some, I guess, non-surgical treatments that you can do.
Exactly. When you don't have one of the warning signs where a patient can't walk or can't go to the bathroom properly, and you strictly have back pain, we usually recommend physical therapy, massage, chiropractic, minor manipulation, traction on the back to stretch the muscles and loosen them, and gentle exercise, non-impact exercise. And then injections sometimes can help with steroids to decrease some of the inflammation and arthritis around the spine as non-surgical treatment options.
Now, what are the warning signs that some of those things aren't working and then you're going to have to look into surgery?
Again, when the chiropractic type manipulation or when the massage or when the injections are not working, you're still having more pain, you start to develop more radicular signs, which are leg pain, numbness, and weakness, and this is ongoing despite the treatment, then it's probably best to see someone like myself, and that's when we would want to get an MRI or some other imaging test, because sometimes a person has a fracture or has a tumor that if you just get a plain x-ray it may be missed. So an MRI will show the pathology, and then if indicated I would possibly treat it. Things that I do that can't be helped necessarily by therapy or chiropractic are treating things like deformity, where there's a scoliosis or where there's a dislocation of the spine, and then sometimes we have to put hardware in the back that looks something like this, which is obviously a big operation. Some people have a really worn out disc, and newer technology, we can actually replace a disc like we can replace a knee or a hip with a artificial disc that allows motion of the spine. So we have a lot of different options for treatment, and they're really based on the cause, or what the cause is, where it's coming from, and what needs to be done to truly treat the problem.
Okay, and you were just talking a moment ago that you'd prefer folks have a referral from the doctor, that then they can come to you and you can discuss both the non-surgical and possibly the surgical treatments to move on from there.
That's correct.
All right, Dr. Tomecek, thank you, sir.
Oh, my
Appreciate
pleasure.
you coming in today. Thank you very, very much.
Thank you very much, Keith.
More information, here's the info. Oklahoma Spine and Brain Institute. They're located at 6802 South Olympia Avenue and Suite 300, Highway 75 and 71st Street, and also 749-0762. And you can also call the 800 number 704-8268. And you can also go online, ospi.net.